More than anything, to learn. We are actively engaged in trying to advance the cause of Medicare coverage for oral health care. It's a big task and a lot of pieces that are moving in it, and I knew there would be a lot of smart people in the room, a lot smarter than I, and I just wanted to learn from them. The data is incredible, and there's so much. It was Judith Jones, I think, was the one who said it yesterday. There are a lot of studies from a lot of different sources coming out with a lot of different findings, but the one common theme is they are all finding savings, which, coming from a Hill background and working in the public policy arena, is incredibly important. I was, however, surprised just at the pure breadth of all the research that's been done. Well, it's we're operating in a resource-constrained environment. Long gone are the days when somebody could come up with an idea for a program that would cost money and Congress would willingly pass it. They now have to have offsets. It was joked yesterday that maybe we'll just do it the American way and add to the deficit. But in fact, it's the deficit that really has created this constraint. We're dealing now with trillion-dollar deficits, something that was beyond the pale of imagination not long ago. So in order to achieve any change in these programs, it's essential that any advocate comes up forward with what's called an offset, some way of achieving or offsetting the cost of that which they want to accomplish. In this instance, we're in a really interesting environment in particular because those that are seeking the change that need to be offset is Congress itself. They are going to have to pay for the extension of certain Medicare policies come springtime. They're going to have to pay for the extension of the Children's Health Insurance Program come springtime, and they have no way to pay for it. And unless they find creative ways to offset those costs, they'll offset them through the old-fashioned way of cuts, reimbursement cuts to a wide range of providers. Now, those providers are all mounting really powerful defenses to keep that from happening. So everyone is looking for alternative sources of savings. The data that shows that oral health care, particularly for medically essential health care for those patients suffering debilitating chronic conditions, is actually saving money for Medicare Advantage plans every day and could save that money for Medicare fee-for-service is a powerful brand new source of savings for Congress. And in that instance, savings for this community can be a real advantage. The community really does need to think about where it wants to go. What I heard were really powerful, thoughtful, experienced views yesterday that were taking two different directions. I shouldn't say different. They're aligned but not identical. One is an ask and the other is an offer. So this is Hill speak. What's the ask? We want a comprehensive dental care benefit in Medicare. Why is that an ask? It's a big, big, big change to Medicare. In the end of the day, it would probably cost money. Even if it wouldn't cost money and could be structured to be budget neutral, it would be viewed as a very heavy lift, another bit of Hill vernacular. The offer is a little bit more focused, and that is Medicare coverage of medically essential oral health care for chronically ill seniors. Why is that an offer? That will save money, as we're seeing in MA. Pacific Dental Services, their foundation, underwrote an Avalier analysis, for example, looking at retrospective claims data from MA plans, and Avalier projected $63.5 billion in savings for Medicare fee-for-service if they took the same approach that MA plans have. So when you have even a tenth of that, $6 billion, you have something that you can offer, as opposed to something for which you're asking. And at that point, when Congress is searching for savings, this community can step forward and say, we want to help. We have a way that meets the triple aim. We have a way that will enable you to improve the lives of your constituents and not burden taxpayers. We have a way for you to help pay for these other priorities that you've got. And even as you do, you'll be improving the health and lives of senior citizens. That's an offer versus an ask. What I heard were both, and what I think the community is going to gravitate to is an answer. Which one are they going to be pursuing? It's not mutually exclusive. It can be done sequentially, but it can't be done simultaneously.